One major principle to keep in mind with all lifts utilizing the CAMEL is that correct positioning on the cushion will result in a balanced lift. It is therefore important to note that each patient is an individual with their own specific weight distribution. Care must be taken to ensure there is sufficient assistance available with respect to the patient's size and/or shape. Begin by securely connecting the 4 numbered hoses with the proper connectors on the cushion. Should the patient be located in the prone position and is unable to come to a seated position without assistance, utilize the common method of log rolling the person to the most appropriate side. Place the slide sheet on top of the deflated CAMEL and bring the cushion alongside of the patient. The patient's head should be aligned with the CAMEL insignia at the top of the cushion. The patient's rear end should be aligned along the top edge of the plastic slats. Bring the deflated CAMEL up to the edge of the person so that when the person is rolled onto the CAMEL, they should be somewhat centered. Now lower the patient from the log roll position so that they are now lying face up on the deflated cushion. The slide sheet will now allow you to maneuver the patient onto the center of the cushion with minimal force. Once you feel the patient has been centered properly, remove the slide sheet from under the patient by gently pulling from the underside of the sheet. This will allow the sheet to roll out from under itself, thus reducing the risk for skin abrasion or shear. Begin the lift by moving to the head of the patient. This position will allow you to maintain the balance of the patient throughout the lift. After ensuring the patient is ready to begin, press and hold number 1 on the 4-way hand controller. The back cushion, or cushion number 1, will begin to inflate and lift the patient's upper body. As the patient begins to sit up, continually check to ensure they are comfortable and are well balanced on the unit. When the patient has come to the appropriate angle, you may remove your finger from number 1 and move on to number 2. By holding down the second button on the controller, the patient will be lifted from the floor. Continue holding number 2 until the second section of the cushion is fully inflated and the compressor stops operating. Now, if needed, you may further inflate cushion number 1 to increase the angle at which the patient is seated. Once a comfortable position is attained, you may move on to button number 3 on the controller. By pressing and holding number 3, the next section of the cushion will be inflated. Continue until section number 3 is completely inflated and once again the compressor stops. Check the height at which the patient is now seated. Should they require additional lift, you may move on to cushion number 4 and inflate until the maximum height of 22 inches is attained. The patient is now in a seated position and can be more safely transferred or helped to stand. However, if you desire to move the patient while on the cushion, you may utilize the slide sheet included with the kit. By placing the slide sheet under the edges of the inflated cushion, the cushion with patient can then be moved easily across the room. Be sure to move at an appropriate pace while paying attention to the balance of the patient. The CAMEL may also be used to lift a patient on a backboard to the height of 22 inches. Begin by attaching the hoses to the rear of the cushion. You will not need to attach the hose for section 1, as this section will not be inflated. Place the slide sheet on top of the deflated cushion and arrange the two alongside the backboard. The patient's center of weight should align nearest to the middle of the cushion as possible. In most situations, the legs of the patient will be off the cushion towards the end. As you log roll or lean the patient and place the backboard under them, place the cushion under the backboard as it is being returned to the floor. The backboarded patient can now be centered on the cushion by slowly sliding them on top of the slide sheet. Now move to the head and feet of the patient to ensure the proper balance as the cushion begins to inflate. Begin the lift by pressing and holding the number 2 on the hand controller. Hold this button down until the compressor stops. Repeat this process with numbers 3 and 4 on the controller, ensuring that each section is completely inflated. For more information on the Mangar Camel, please contact Oak Point Medical Products at www.oakpointmedical.com or call 877-461-1614.